Okay, I'm Dr. Jeremy Gehrman, and we're going to talk about a case that we just saw of plantar fasciitis. It's a common problem. It presents as heel pain, and more specifically, it usually is the front inside part of the heel, what they call the anterior medial heel. So people say, it hurts right there. And a lot of times they say it hurts worse in the morning. And one of the reasons for that is that when we sleep, our feet point down. And you can imagine the plantar fascia that connects essentially from here to here, it shortens when you plant your feet down. And so when you get up in the morning and it pushes your foot back, it stretches that fascia. And you essentially get micro tears in that fascia. And so people will say, once I get out of bed, it's really painful. So the first treatment a lot of times for plantar fasciitis is to wear a brace or a sock looking thing at night that's called a Strasbourg sock, or just a plantar fascia brace. But it essentially keeps your feet back when you sleep, and so it keeps that fascia elongated so that when you get up in the morning, it's already stretched out, so it doesn't have this quick sort of traumatic stretching when you step on the floor. So again, patients will say pain on this side of the heel, and one of the most helpful things for me when evaluating these people is doing an ultrasound, because the actual appearance of the tissue tells you a lot about the problem and how in fact to treat it. So again, usually presents at the front part of the heel, and with this ultrasound, I'll show you on the big screen. This is the calcaneus, or the heel bone, the white line, and hopefully you can appreciate it from your perspective, but this band of tissue is the plantar fascia. And this is a normal looking plantar fascia. It's relatively thin, it's lighter in appearance, and if I flip, let's see the right way, to the other side, you might be able to see how this is thicker now and also darker. And I'll flip back again, and here we go, thinner and lighter. So fascia is much like tendons on ultrasound. When it's abnormal, it looks thicker and darker. And this is a more mild case relative to some that I see. So the patient had already been trying the nighttime bracing, and we actually ended up deciding to take the next step and do an injection. And that's the other cool thing about ultrasound, is you can guide that injection right where it needs to be. So in this picture, I actually had flipped the ultrasound probe so that now you don't see the fascia in lengthwise, you see it in cross section. So this is it right here. This is the heel bone to which it attaches, and of course this is the needle that's depositing medication right on top of the fascia, which is much more safe than what we used to do, we being providers in the medical community, which was just stick a needle straight through the foot, maybe into the fascia, and inject, which is not the best idea. You don't want to get it into the fascia itself. So very common problem. There are a lot of other treatments. For more advanced cases, we can do percutaneous fasciotomies, which is essentially through a needle hole. We can sort of clean the fascia up. But a lot of conservative options now. So if plantar fasciitis is something you're having a problem with, give us a call. I'll be happy to help you out. But that's a little bit of education on the problem and what you can do about it.
What about regenerative treatments for plantar fasciitis?
So that's something else that we've had a lot of questions about. Is, I heard about platelet-rich plasma and other things for plantar fasciitis, and they're good options. So this patient in particular has a trip to go on this weekend, so we wanted an option, something that would yield quick results. But for fascia that has been kind of beat up over time, it looks sort of ratty on the ultrasound, and you can encourage healing of that with platelet-rich plasma and several other regenerative growth factor-based treatments. So it's done much the same way, through an injection, and the patient actually just told us that it was not very painful at all, that it hurt much less than what was it?
Bicillin shot.
Bicillin shot, which is a what?
For strep throat.
Yeah, strep throat, right. So you can tell I'm not primary care here, but so it was very painless. But something we do a lot is regenerative treatments, anti-inflammatory medications, and of course we always look at the mechanics and figure out why they developed this in the first place. So anything else?
I think that's it.
All right, that's plantar fascia for the day.